Welcome to video number 3, how to find the best MOUD provider. How to make a referral. I suggest to watch video number 2 in the series, how to build your resource list. As mentioned in the previous video, a warm handoff is always the best option when possible. Talk to the patient first and find out what services they are looking for. People usually know what they want. Give them all options and find out what area they live in. For example, do they live in the north, the southeast, or west of the town? The patient is living unhoused in Spokane and wants to start Suboxone. I find out the location that they stay in and if they have access to a vehicle or a phone. Based on their situation, I refer them to a program that would best fit their needs and the experience that they are looking for. For methadone, make sure you go over the list of requirements and follow the same steps as above. Patients are always allowed to change their mind. The help they receive doesn't change if they come back or want something else. If it doesn't work the first time around, keep helping them to try again. Sure, it's a good fit. Being a care navigator means doing motivational interviewing to learn as much as possible in order to refer them to the right place. A good resource list is vital. Get to know the places you refer so you can provide your patient with lots of information. If one place doesn't work, most of the time there are others. Some places might not work for reasons other than just barriers. It could be about the environment, or how a particular office makes them feel, or the entire vibe of the place. How to make sure it's a good fit. The same is true for MOUD medications. Suboxone will work for some, and methadone will work for others. Patients can try as many times as they need. Our job as care navigators is to help and support them. Everyone needs to find their own treatment plan that is right for them. Again, treatment isn't a one-size-fits-all. Some places may be too high barrier for them. If a location has too many barriers, it won't be a good fit for the patient if they're new or they're just starting their recovery journey. Some examples are they have attendance requirements, like showing up every day at a specific time, or they have abstinence requirements. Personal barriers can also make it hard for someone to achieve their goals, like lack of transportation or lack of access to communications. Remember, always follow the patient's goals, never our own idea of what they should be. We are simply there to help them, not force them. Some places may be too low barrier. Some locations may not have enough structure for some patients. Some patients need more requirements and a clearer path than a certain location provides. Some patients struggle without set appointments, or if they're allowed to come in whenever. Requirements can sometimes keep patients focused on their goals. Early recovery is very fragile and can easily be disrupted no matter how focused or driven someone is. Returning patients. It is easy to get overwhelmed or lose faith in a patient when they return, and you have to start over. But the fact that the patient returns says a lot about them and the care they have received. The more times you work with a patient, the more trust is built. This can make it easy to help them. Some people don't have anyone else for support except for you and your network. There will be an upcoming video on self-care and how to prevent burnout. Thank you for watching, and as always, please feel free to reach out to me if you have any questions or you would like any additional training or advice. Thank you.